Hello, good morning. This is Neil Arwin Mercado, and this is the Inside Look. Joining us here today is Valenzuela City Mayor Rex Gatchalian. Sir, good morning.
Good morning, Neil, and thank you for having me this morning. Thank you. Hello also to all your televiewers.
Sir, I know na busy kayo right now, so let's dive in sa ating mga tanong. Let's talk about the COVID-19 situation over there in Valenzuela City. Sir, what is it like right now?
Um, Definitely, there was a surge. There is still a surge. We were right before the month of March. Right before March, we were only doing less than 500 active cases. So when March came in, as well as April, we saw the numbers rise to a point that we were doing 1,300 active cases. But now, after the ECQ and the MECQ, we're starting to see the numbers go down again. Our positivity from 20% is now down to 18, 19. Yes, it's going down, but it's not going down as fast. So the news last night of an extension of an MECQ is much welcome because we really believe that that will make sure that the numbers continue on its downward trajectory as well as the positivity rate goes down. We all know naman yung rate of infection bumababa na eh. So I think in time, we will also see a lowering of positivity and a lowering of cases. Neil, right now, our active cases, sabi ko nga kanina, we were doing at least 1,300. Now we're back to 800, 1,000. Hopefully, we don't reach that again.
So there is a downward trend, sir, but you said that it's not as fast because
Yes.
Before March, you said you're around 500. Now you're at around 800. So it's still higher than before.
Yeah, actually, that's correct. I think that's also been noted nationally or NCR-wide that the rate of infection is down, the positivity rate is down, but the numbers aren't going down as fast. Maybe because the new variant is more contagious. Kasi halimbawa, we register X amount of people for recovery, napapalitan rin kaagad because may bago na naman na cases. But definitely, we're seeing a decline in the rate of positivity also in Valenzuela.
What is the pandemic response like, sir, in Valenzuela City? Let's give our viewers a picture of how it's going in Valenzuela. Let's say someone is reported positive. What do we do with that patient?
Actually, Neil, number one, we've always said that it has to be consistent in the application of protocols. From day one, whatever protocols the national government gave us, we followed it to the dot, and even up to now, we're still following it. What do we do? Number one, what did we do and what do we do? Number one, we set up a mega contact tracing center. This is a 200-seat call center manned by medical practitioners, either doctors, nurses, or allied medical workers. Sila yung contact tracers namin. So the call center is something that we're proud of because actually the IATF came here and looked at it. It's a central number where everybody calls in. So a person, there are two tracks. Let's say a person has symptoms or has exposure, they'll call. The call center agent will brief them on what should be done. And since we have our own lab, yung Valenzuela Hope Molecular Laboratory, we are also able to schedule them immediately for free PCR tests. In Valenzuela, we don't do rapid tests, we don't do antigen tests, we only do PCR tests. We have one of the bigger labs in Metro Manila. We are able to run 700 samples in a day. So we will tell you, okay, stay at home. We will send you the home swabbers. You will be swabbed. In the interim, while you're being swabbed and waiting for your results, malalockdown yung bahay mo. Kasi nga may symptoms ka na or may exposure ka, so you can be potential carriers. May tent na itatayo sa labas at ang nagbabantay doon barangay. Our lab results come back 24 hours to 48 hours. So by the time the results come back, our call center will touch base with you again and tell you the results. Kung negative, end of story. We tell you to self-isolate, but the lockdown is released. But if it's positive, we will now do the contact tracing with you. The agent will be asking you for your close contacts, for people you might have exposed. And that positive person will be brought to an isolation facility. We have 14 in our network of isolation facilities in the city, a total of 1,300 beds. Neil, in Valenzuela, we don't do home quarantine. Home quarantine is strictly prohibited in Valenzuela City. The only time we allow home quarantine will be for people who are bedridden. Diba? Yung mga terminally ill na nagpa-positive. Pregnant women, women who just gave birth, senior citizens who have orthopedic problems na hindi makakaakyat ng hagdanan. The reason why they're allowed to do home quarantine kasi lalong makakasama sa kanila kapag ginalaw mo pa. So the lockdown of the house continues kasi hindi naman namin sila mailalabas. The lockdown is only released when you finish the 10-day quarantine period. In that interim, when we put a lockdown in your house, you are also given food provisions. A food box is left at your doorstep. That's around good for 10 to 14 days for a family. Now, but most of the cases, I would say 99% of the cases are brought to isolation units. And then, like I said, tatawagan ka ulit, you'll be pulled out, brought on isolation unit. But at the same time, your contacts will be swabbed and given the results after 48 hours. And then pag positive sila ulit, dadalhin sila sa isolation unit. Now, in certain cases, di ba, pagka tumawag ka, nakakalimutan nila pag tinanong mo, sino ba yung contacts mo? Ang matatandaan niya normally will be family lang and co-workers. Last October, we launched the country's first LGU QR code system, yung ValTrace. We're proud of that because it won actually accolades from DILG and DICT late last year doon sa DICT Awards for being an innovation in contact tracing using technology. So in Valenzuela last October, we launched a ValTrace, which is a program that makes citizens download their QR codes. It's actually interlinked now with Pasig's QR code, Mandaluyong's QR code, and Antipolo's QR code. When I say link, our QR code pwede gamitin doon. Interoperable siya. Their QR codes pwede gamitin dito. We have a strict no QR code, no entry policy. Meaning, hindi ka makakapasok sa mga enclosed establishments dito kapag wala kang QR code. If mahuli namin yung establishment na hindi nagsascan, they can lose their business permits. The database of ValTrace is near universal, or in fact, it exceeded our population. 1.2 million na ang users niyan. 680,000 lang ang residents namin. So meaning pati mga nagtatrabaho dito, bumibisita dito, they downloaded their QR codes. Now, why am I talking about the QR code? Because again, during the contact tracing phase, the call center agent will also pull out your trail. So kung sakaling nakalimutan mo saan ka nagpunta for the past 2 days at puro pamilya lang yung natatandaan mo na contacts, we will tell you, oh, Neil, pumunta ka sa ganito, di ba? Ay, oo. Then they'll be able to give us more contacts. ValTrace is actually an efficient way of contact tracing. It gives us a more expansive and richer database, so to speak, of contacts. Then we test those contacts and bring them to our isolation facilities. Last, Neil, there are certain cases, of course, that will require hospital care. In the isolation facility, our rescue teams, our CESU will also tag those, refer them to the right hospitals, and our rescue team will pick you up and bring you to the isolation facility. So medyo end-to-end yung program namin kasi that's what we're saying is, in dealing with this pandemic, we understand what DOH or IATF said from day one. The approach has to be holistic, from testing to contact tracing to treatment, which is isolation. It has to be consistent. So every Valenzuelano will go through that process. And it has to be standardized for everybody. Meaning mayaman ka, mahirap ka, lalaki ka, babae ka, walang home quarantine sa Valenzuela. The application of the protocols are the same.
This brings me to my next topic, which is facilities. So how you mentioned, sir, I'm particularly interested with what you mentioned that as much as possible, there are no home quarantines in Valenzuela. How do you
Hindi as much as possible. Talagang dapat wala.
How do you balance that policy of as much as possible, no home quarantine, and making sure that the isolation and quarantine facilities will not be filled?
We just have to keep on setting it up. Like I said, we have 1,300 beds, and that's more than enough from our peak. So lagi kaming may extra bed dyan. There's nothing to balance eh. People here in the city has that built-in culture already after doing it for 1 year na alam nila na it's for their own safety, it's for their own family safety. Kaya nakakatawa, Neil, they will follow up with us pag halimbawa may delay sa sundo. Susunduin mo kasi yun eh, pinapasundo namin eh. From household, diretso sa isolation facility, they'll be calling us, nasunduin nyo na ho kami. Kasi after a while, after 1 year of consistent application of the no home quarantine policy, it became a culture in Valenzuela. Now, syempre, minsan may mga matitigas yung ulo, ayaw. Pinadadala namin yun talaga ng medical practitioner sa bahay to explain thoroughly.
Just for the record, sir, how many isolation facilities, quarantine facilities?
I mentioned it kanina. We have 14 for the city with 1,300 beds.
Now let's go to hospital utilization naman, sir, because those two are different facilities. The quarantine isolation facilities, they're different with our hospitals. So I have some numbers here for Valenzuela. Currently, overall bed occupancy for Valenzuela is 62.8%. This is moderate.
I beg to disagree. Okay, hospital facilities. Wala yung moderate sa hospital facilities. The mild to moderate are all in our isolation units.
These are numbers from the
Ang,
DOH, sir.
sadly, Neil, and I'm going to say it again, that there seems to be a discrepancy lagi with what the DOH is reporting and what's happening on the ground. Remember, the moderate
what is on the ground?
Yeah, the moderate cases are not in the hospitals. Diba? We were all told that mild to moderate cases should be in isolation facilities. Ang nasa hospitals namin yung critical severe cases. Right now, they're hovering at a still very high utilization rate. Our private hospitals here recently, talagang naging surge. Hindi kami makapasok. But now we're seeing parang loosening a bit ng mga utilization. I don't have the numbers with me right now kasi I wasn't able to get it from last night's review. But empirically, I would say it's running at a high of around 85 to 90%. COVID ICU and COVID beds.
What sir ngayon ang measures ng city government to make sure na hindi tayo aabot sa critical levels when it comes to our hospital beds for COVID-19?
Neil, umabot na tayo doon eh. Kumbaga, nandun tayo and palabas pa lang tayo as we speak. Again, it's just the consistency of application of protocols. I always keep on saying the national government has already laid out these rules and they know what they laid out. It's critical that you break the chain of infection. That's why we are consistent with the contact tracing using technology as a matter of fact. And number two, no home quarantine. Naniniwala kami that breaks the chain of infection. It gives our hospitals the breathing room na wala sila doon kasi nasa isolation facility sila. Pero at the same time, hindi sila nakakahawa kasi they're tucked away safely in our isolation units.
What sir ang provided natin sa isolation facility?
Everything
provided to them.
Food, vitamins. When they walk in, they get a welcome kit. The welcome kit will contain everything that they may potentially need when they stay there. They also get bathing equipment, meaning kasi remember, some of the isolation facilities are schools. So they weren't really meant for stay in. But the toilets are clean, so we give them pail and wash basins so that they can bathe. Food is provided for. Our isolation facilities have medical practitioners also on site, nurses and doctors to check on them regularly. Kasi just in case from mild to moderate they turn to critical and severe, then we have to move them to a hospital facility. So those are all provided for. Ang importante is we give them that. We don't give them a reason to demand na magstay sila sa bahay, but rather they would rather want to move to an isolation facility kasi it's not your 5-star hotel, but it's clean, it's comfortable, and you get the proper medical care needed.
Now let's talk about vaccination, sir. What is the status of the vaccination program over there in Valenzuela?
It's been ongoing and it's running in Valenzuela. We employ a strictly no walk-in policy. We do everything by appointment. So meaning people will apply online using our portal where they got their QR codes for contact tracing. They fill up the medical forms there. Then they get an appointments letter delivered to them. We make sure that when they get to the vaccination center, they won't get contaminated there. So that's why by appointments, para naka-social distance sila. Per block hour, limited yung tao na pumupunta. It's a safer way, I would say, of inoculating our people. We've already done around 15,000 first doses. In 1 to 1.5 weeks time, yung supply na hawak namin should be finished. But I was told the DOH will be sending more supply. So it's an ongoing process. People register online, you get your appointments letter, and after which you get inoculated.
Balikan ko lang, sir, how many, ilan po yung nabakunahan natin? Around 15,000 for the first
16,000 actually. 16,000.
For the first dose, sir.
Yeah.
May nakakompleto na po ba ng doses?
Meron na. We have around 2,000 na nakakompleto na. Of that 16,000, 2,000 of those already have their second dose.
These are, I'm assuming, healthcare.
A1. Yes, the A1, the medical frontline workers. By May 8, yung second dose ng people with comorbidity and senior citizens will start coming in already.
Is Valenzuela City having the same problem as other LGUs, say, with regard to
hesitation,
supply of vaccines that's coming into their city?
Again, Neil, number one, I do understand that there is a global shortage of vaccines and we understand that situation clearly. We're one of the few LGUs who bought AstraZeneca that's due to arrive pa nga July pa. So we were really programmed to run our inoculation program from July to December. So what we're using now are supplies coming from the national government. Ako, I understand that the current world market, bilang naman sa Philippines yan medyo masikip talaga. Lalo na with what's happening in India, what's happening in the United States, wherein they're inoculating their citizens first. There's a chronic shortage or a tight market supply. So I understand that whatever supplies there are for DOH is limited, but we do get our share of that. And I'm very thankful because we get our critical communities or sectors inoculated first. The medical workers, people with comorbidity, and senior citizens. I would like to have more, but I understand, like I said, I understand the current global situation. But it doesn't mean that we're not getting any. We do get supplies from DOH, and we actually program our inoculation routine based on the supplies given to us. The bigger challenge will probably be trying to convince 100% of your population to get inoculated. But it's getting better. When we started the program, yung sa people with comorbidity, sa by appointments natin, around ang turnout namin nasa mga 45 to 55% lang. That was a month ago. Pero 1 month later, now it's up to around 75 to 85%. So meaning, nag-double yung mga tao na gustong magpabakuna. I really believe na the best-selling proposition is when they see their family, their relatives, their neighbors get inoculated ng safe. So for us in Valenzuela, we believe na giving them that experience na pagdating nila sa vaccination site, well-guided sila, hindi hassle, hindi sila may social distancing, convenient, comfortable, clean, will be part of that overall selling proposition na pag uwi nila sa komunidad nila, kaya nila ikwento na, hindi lang safe, ang dali pa magpabakuna doon, hindi hassle. So we're seeing as we inoculate more Juan de la Cruz, they become the salesmen for the program itself.
So currently, the city government is using the supply given by the national government.
Yes, but by July,
specifically by the city government. So how many have we procured for the city government? Yung deal entered.
Yung for that will come in second half of the year. We bought 640,000 doses, so that's 320,000 individuals. That's 70% of our adult population, which was the target herd immunity. But obviously, the national government has also bought for Valenzuela, so we'll have more than enough for everybody.
So you currently have no worries as to possible shortage in the future.
Nabili namin, Neil, pero dadating ba is another question. Diba? We all know that there are twists and turns to the pandemic story. What's happening in India right now, where a lot of where a couple of major serum or vaccine production plants are now being pushed to supply for its local community, is affecting all of us all of a sudden. So, ang point ko, we procured, we forecasted to the best of our ability. Now the challenge is hopefully the deliveries arrive as prescribed for the second half of the year.
Now let's go to my last topic, sir, which is the announcement last night of the extension of the MECQ in the Metro Manila area. Sir, what are your thoughts on this?
Well, I agree. I've always said now the Valenzuela city government will always toe the line and follow the national government, because we know that they have all the experts to do the data analysis. They have all the experts to guide us through this pandemic. So we will heed that no matter what their decision will be. But it's much welcome that MECQ is extended, because that's what our local doctors are also saying. Our local epidemiologists and pathologists are also saying that if we could only extend it, it would even be better. So nagsisynchronize yung gusto ng local government and ng national government. So that's why it's much welcome. But we do understand that there may be some revisions or minor modifications to allow a little bit more economic activity. And we also understand that as a socio-economic issue that needs to be addressed, it cannot be one-dimensional. It should be treated as a holistic approach, wherein we look at the economic impact of whatever health decisions we make.
Because this has been the story of the pandemic, sir. At least when we impose lockdowns, it's the balance between the health and the economy, sir. So we are extending MECQ, so it might have a little bit of an impact with our...
But I don't think it's as harsh as a total ECQ. The MECQ, may public transport, which is crucial for people getting to work. Industries are open. And the important thing there is people are somewhat allowed to earn a living. Yes, hindi man lang 100%, but the important thing is make economic activity.
Do we also provide assistance probably to MSME, sir?
Right now, we're working on a relief package for business taxes.
Mhm.
We're already running our numbers. We didn't see kasi this new second round of ECQ taking place.
Mhm.
So what we're doing right now will be looking at taking cognizance of certain MSMEs that got hit so many times, yung mga barbershop,
Yes.
spas, personal care, gyms, yung mga laging tinatamaan pag nag-ECQ. So we're now coming up with a relief package wherein it might not be given to them in cash, but rather it will be given to them in relief, waiving of business permits, discounts in real property tax. That economic package is about to come out in the next 1 to 2 weeks.
Right now, you're just running the numbers, planning on how it's going to be
Oh,
implemented.
kasi Neil, you have to remember, we didn't see this ECQ come again. We all thought that we were out of the woods nung bumaba in numero.
Yes.
Now that it's here, now that it's been implemented, we understand that MSMEs are hurting. That's why we need to provide the economic relief that they need.
Sir, I guess final question is, how can you assess the response of Valenzuela? Is the city government, from your eye, doing enough?
I will not want to answer that because para ako nagbubuhat ng sarili kong bangko, Neil. Maybe you really have to ask. I'm sure you have colleagues who also somehow have stories about Valenzuela or live in Valenzuela. I would rather leave it at that. Pero if there's one thing I can tell you, the local government from day one tried everything in the arsenal that we can probably launch. We didn't skimp on anything. That I can tell you. Yes, it's not a perfect response, but we did learn along the road. Everybody learned from the whole battle. But I would not want to grade myself because that's parang nagbubuhat ng sariling bangko. I would rather leave it to you to do your I guess soundboarding sa mga iba mong kasamahan who have run stories. You guys have a very active Kamanava beat reporter. She would know. Si Meg yun eh. So she would know. Or si Nika. Dalawa yan eh. You can ask them on what they know and what they've heard on the ground.
Any message na lang, sir, to the people of Valenzuela?
Well, ako, simple lang. Sa mga Valenzuelano na nanonood nito, maraming salamat sa inyong patuloy na pagtitiwala at suporta. Ang panawagan ko lang, sa mga hindi pa nagpaparehistro para sa ating VC-Vax program para sa bakunahan, mag-login na ho kayo kung saan nyo kinuha yung QR code nyo. valtrace.appcase.pet. Put in all your medical history there. It will only take you 2 minutes. Para pagdating ng panahon na yung sektor nyo ay pwede nang bakunahan, doon kami kumukuha ng mga binibigyan ng appointment.
Okay, thank you so much again. That is Valenzuela City Mayor Rex Gatchalian. Sir, maraming salamat sa inyong time. I hope you can join us again maybe someday for another interview. Hopefully after tapos na yung pandemic, by the next time we get to talk again.
Neil, thank you for having me. Maraming salamat and magandang umaga.
Again, this is Neil Arwin Mercado, reporter for INQUIRER.net, and this has been your Inside Look.